everybody. I'm Dr. Vijay Agarwal, a senior consultant cardiac surgeon currently working at Palm Hospital, Lucknow. We wanted to share a very good news of a child who had come to us from Ghana. This baby was around 9 months old, and he had a defect in the heart, which was diagnosed at the age of two months in Ghana, in Accra. They were concerned because the child was not putting on weight. He had multiple other problems, urological problems as well. So we got to know about this patient at the age of 6 months of age, and the diagnosis of large inlet VSD and patent ductus arteriosus was made on the echocardiogram. The diagnosis essentially means that there is a defect or a hole in the heart between two chambers, between the right and the left ventricle. We know that there are 4 chambers of the heart, and the defect, the hole was a large hole, causing mixing of the blood. Plus, there was an abnormal communication between the aorta and the pulmonary artery, that is what is called as PDA. Because of this problem, the child, no doctor in Ghana was ready to operate on the heart defect, because on the heart defect, as well as this problem of his urological problem was not possible to be done without the heart defect getting sorted out. So they contacted us here and contacted me, and we decided to take up this case. It's good news that this would be probably the first international case in Lucknow, and it actually augurs well for the city, where the growing medical facilities in the city will get a boost from this case. So nevertheless, we received this patient on the 21st of July. They flew all the way from Ghana, and we operated on this child the next day, which is on the 22nd, on a Tuesday. The operation essentially went uneventful, and we had a team of experienced cardiac surgeons and anesthetist, which we who specialized in pediatric cardiac anesthesia. And this team at Palm was very enthusiastic about this patient as well. Although we were doing a lot of these pediatric patients, obviously there was some excitement about the international case, and the team actually had to work just normally, and the baby thereafter had a very uneventful recovery. The baby actually came with the father and her aunt, the mother's sister. They flew down all the way. They also had little problems, which they actually consulted doctors in Lucknow because of the fact that they were very happy with the treatment here. So all in all, congenital heart disease is very under focused in India, especially in UP. So the condition of congenital heart disease in India is that about 2 lakh children are born every year, and only about 20 to 30% of them get treatment. The situation is much worse in Uttar Pradesh. The number of hospitals treating congenital heart disease can be hardly counted in to 1 or 2 at most, and the disease load is actually huge. Most of these children are going actually to Delhi and other parts of India to get their treatment done. We at Palm are very happy to have them here, and we have a strong team which will be able to look after them as they have a lot of experience in this area. The other reason why congenital heart disease is not getting focus is because the parents are newly married, and they may not have enough funds to offer treatment for their child's operation. But the good news is that Uttar Pradesh has a very robust Ayushman Bharat and Chief Minister's Fund, through which they can be helped. And therefore, it would be my appeal that no parents should think too much about getting their child operated because of the lack of finances. And the results are actually very good. 80% of them will be cured. They will have a good duration of life and good function of life. So there are a lot of positives in getting a child operated, and I would urge everybody to take up this matter more seriously, and see a doctor, either a pediatric cardiologist or a cardiac surgeon. And we are happy to offer any help with children with congenital heart disease. Thank you.
I'm Benedicta from Ghana, a nurse by profession. In fact, about 3 months ago, my sister's second triplet was diagnosed with PDA, then SVD, that's ventricular septal defect. Upon this diagnosis, it kept the whole family worried. Apparently, he had shortness of breath, then he had a low weight of 4.5, even at 8 months. This was really a problem to us. After meeting Dr. Ofe, who is a cardiologist at the University of Ghana Medical Center, he introduced us to Tender Palm Hospital in India. Actually, it was Tender Palm Hospital that facilitated our visa, and within 2 weeks, we were already in India. On arrival at the Lucknow airport, we were received by the hospital team, and then we proceeded to the resort where we were warmly welcomed. Actually, the treatment was so amazing. We were so impressed by the way we were welcomed into the city. After that, a series of investigations started. A number of investigations were carried out on my son. Then, in no time, surgery was done. Surgery was very successful. Prior to the surgery, I had the opportunity to meet the pediatrician cardiologist, the person of Dr. BJ Agawal, and then he assured me that nothing was going to happen to the child. My major concern was with the weight of 4.5. I was actually not certain whether a good job would be done, but he assured me there was nothing to worry about. And actually, surgery was done, and baby was doing very well. And actually, up to now, the baby is currently doing well. So the closure was done for the baby, and the kind of treatment we received from the facility was amazing. We had a lot of good doctors coming into play. We had a lot of I would like to say that from Dr. J. Agawal, Dr. Snell, the other medical doctors at the ICU, with the ICU nurses, were so amazing in terms of caring for the baby. So I'm so grateful about the kind of care that was given to the baby. On behalf of my sister, I would like to express my gratitude to the management of the hospital, most especially Dr. BJ Agawal, Dr. Sway, and all the medical staff who actually helped with the process. And I would also like to use this medium to encourage any mother or family who has a similar situation, that they shouldn't panic. Even low weight as 4.5 can be handled. So if they have a similar situation, they should not go to any other place apart from Tender Palm Hospital, because they are the best when it comes to this type of surgeries. Thank you so much.
My name is Respect Aruvere. I'm from Delta State, Nigeria, but I live in Ghana, and I'm a civil engineer. I have a triplet, which my wife gave birth to triplet, and the middle one among them was not feeling fine. But after diagnosing him, they found out that he have hole in the heart. So that was why from there my wife tried to meet Dr. Fair. So then I was also busy. He referred us to Dr. Gawa in Tender Palm in India. So I said I was contemplating at first. I said the journey is going to be difficult. How can I take my son to Tender Palm? But Gawa gave us a word that as soon as we bring my son here, he's going to be fine. So we said, okay, I give it a try. And true, my son is very healthy and fine, smiling and all that. So I want to thank everyone that thank you very much for what you put done. And I'm also using this medium to invite all Africans in Ghana, Nigeria, that if they have any heart issues or any surgery problems, we Tender Palm 100%. they don't have problem. Your problem is solved 100%. It's guaranteed. So if they want to confirm, they can contact my company for confirmation. Resarus Ghana Limited is a construction company. You can contact me. I will give you direction. Yeah, you will enjoy. Everything is perfect. Everything is serere. You don't have problem. Thank you very much.